Thank you very much, Jorn. Well, I saw that basically sleep was involved in all the conditions, so please make sure you go at bed pretty early tonight. Capgemini is helping organizations to transition using the digital tool. And I'm happy to welcome now Antoine Bourrier, practice lead in digital healthcare, who will talk about trust and engagement in that space. Antoine, the floor is yours.
Okay, so can you go on the first slide, please? Oh, it's me to do it? Okay, thanks. Yeah, perfect. Cool. Hello everyone. I'm happy to be here and to talk quickly with you about trust in digital health. So we've been talking about digital health solution for few minutes now. How they can build nice thing for patient, for HCP, for monitoring condition, putting new drugs on the market, plenty of advantages. But there is one thing that needs to be important here, and that's why we are all here, is trust in this solution, because trust will condition adherence and engagement to this solution from patient and from HCP, healthcare professional. So I wanted to touch on 3 key elements for us when we start building digital health solution. 3 key elements to take into account when we want to build trust. The first one is to onboard the patient. It's really important to onboard the patient within the scope of a relationship. You trust people that you think are qualified to give you advice. So here, the relationship might be the one with the pharmacist or the doctor, but you can imagine new actors, like we were talking about Garmin, or all those people who provide companion technology, because as of today, you might trust as much your iPhone than you will trust your potentially your doctor sometimes. So it's important to understand this onboarding, all this part can be built, but it always implies full transparency. You need to onboard the person while educating them and explaining them in full transparency why are you doing it, what value you will take out from it for you as a company, but also what value you bring to your patient. And we come to the second point, retaining the patient. You need to give and bring added value. So, of course, the value can be for you as a pharma company or for the HCP to monitor the disease, to gain some time, to do prevention. But in the end, the patient own his data. The patient choose to remain on treatment and to be adherent or not. So you need to give a value and display the value and share the value continuously with your patient. And this is really important. We see very often in our daily engagement with our clients, which are big pharma company and all, that a lot of digital solutions are pushed. And when you check at it, you're like, this solution is bringing value for the pharma, for sure. But why will the patient use it? So this is really critical. And finally, how you can do that, also bringing the value is nice, but you need to bring it in a way you are attracted to it. And you need to do it through behavioral design, take care about the user experience, and yourself as a person who builds digital solution need to continuously learn and update your solution. So the good thing with digital solution is that they gather data. So this data might help you to learn what happened with your app, what's the usage and all, analyze that, and update your solution according to that. So this is the key element to build trust when you build a digital solution. Now, I wanted to touch about the value. We're talking about bringing value, value for care. So when you will build a digital solution, generally we'll start by thinking if you want to build it in a way which is a bit efficient, you want to improve the patient journey. So first you map the patient journey, you understand your patient, your HCP, what happened to them, and then you try to improve their journey by potentially putting the patient at the center, empowering the patient with his own condition, and do some personalized medicine through which you will be able to address the specific need of your patient, but also thanks to personalized medicine, you will be way more efficient in your treatment because you will treat the patient in function of his physiology and his condition. So that's your goal. That's when you design your solution. You didn't even start developing anything. You just think about that, and that's the strategy you need to put to start to build tools and services. Can be smartwatch, can be whatever device, or smart injector, inhaler, sleep monitoring armband, plenty of devices, but this is just tools and services. They are enabler. It's not your goal. You will also go through data, AI, to learn more, to gain more insight on the condition, to build better therapeutics. But again, this is just enabler for you to reach the goal. And the goal in the end is to increase the treatment value. Treatment value for the patient, meaning they will have better care, better health outcome, and a better quality of life. If you keep those two at stake in the whole journey, when you dive into tools and services, design and development, and data processing and all, you will not lose the main thing, and you will be able at some point to find some value for your patient that you can share. And that's why we have this kind of circle where you say you collect the data, you do whatever you want with it, and then you will build evidence with those data. And those evidence you need to share with your patient, not just with the doctor. You really need to onboard your patient in this journey. So that's that's a bit the point. This is all learning we have from all the job we are doing with pharma and medtech company here in Switzerland. But yeah. The way we kind of build this solution, I wanted to touch a bit on three aspects. There was, just to remind you, the strategic perspective where you try to think about where you want to go, how you want to go there, how you will design your solution, and how you will create value for everyone, ensuring the job to be done of every actor of your chain of value. You need also to focus a lot on human insight. And here I wanted to do a game, but is there anyone in the room who is working in an hospital as a caregiver? Is there a doctor or a nurse? Can you raise the hand? One? Okay. So, yeah, we are here in a room talking about building trust in healthcare, and we have just one caregiver in the room. And I'm just making a point here because we hear a lot about new technology, or it can improve health outcome, or we can do great digital stuff, AI, data, and all. But healthcare is health and care. And the first thing that the patient is expecting is care. And you cannot do anything without thinking human, without thinking human interaction and caregivers. And they are key to the equation. And I think we are forgetting a bit them too much, to be honest. This is just a point of view. And finally, outcome focused, as I was saying. From the beginning, you need to think about what will be the outcome of your solution in terms of increasing the treatment value or increasing the quality of life of your patient. And of course, if you do that, you will find a way to bring value to your own company as an innovator, or if you are in a big company. Yeah, that's basically it. And I wanted to share a few stories of things we've been working on recently, just quickly, because I cannot obviously say a lot about that. But we've been working on connected asthma inhaler by building web portal for the HCP to track the good intake of the drug and to follow the intake of the drug and the progress of the disease in function of that. And also a companion app for the patient to see this intake of drug and follow it the same way the HCP is following it. So if the patient wants to get rid of the practitioner, he can. He has the same information, but as he has the same information, he will go to his doctor with the same level of information, and the interaction will be way more efficient for both of them. Connected insulin pen, of course, you know a lot about all those kind of device around diabetes. Diabetes is quite interesting because it's one of the first fields which was using a connected solution. And one of the reasons there was a good adoption there is that it was really giving control to the patient for them to change their life and have control on their diet and everything. So it was really giving something huge to the patient, which was control over their disease, autonomous. Last but not least, we are doing this amblyopia treatment app with a large pharma company in Switzerland. And for that, the funny thing is we are working also with a gaming company, very famous, and we are using a gaming approach to onboard and engage our patient, because our patients here are 12-year-olds maximum. So we are using the gaming approach because there is a component which is the fun, if you want to bring kids to use this kind of solution. So the lesson is just you need to adapt really to your target population. Thank you very much.